Good morning, everyone. Thank you for joining us for today's webinar, Create a Revenue Engine, Create Census Recovery. I hope everyone is doing well and staying healthy during this ongoing challenge with COVID-19. We recognize the extraordinary work that you've been doing through this crisis, and thank you for all that you're doing. I'm Wendy Johnson with the Pennsylvania Healthcare Association. Before we begin, I have a few housekeeping items to cover. PHCA offers monthly webinars to members to receive updates from department staff on regulations, learn from industry experts on current trends and practices, and to gain a better understanding of practical application tools to equip you so that you can continue to provide the highest level of quality care possible. This webinar is being recorded and will be made available on the PHCA website. The webinar has been approved for 1 continuing education credit for PHCA members. Credits will be uploaded to NAB within the next 2 weeks for those who have provided us with your unique NAB number, and I will be sending attendance certificates as well. A survey will be launched at the close of the webinar. Your feedback is important to us and our speaker, so please take a moment to complete the survey. All attendees will be in listen-only mode. However, we do want you to ask questions, and we will have that opportunity at the end of the webinar today. So please feel free to submit your questions using the question pane on the right hand of your screen, and our presenter will address them at the end. Today's webinar is being presented by Veronica Fogelman, President and Founder of Ledgerock Consulting. I'll now turn the webinar over to Ronnie.
Well, good morning and welcome to Create a Revenue Engine. Today we're going to be talking about some methods, recommendations, systems, tools to hopefully get us to be able to kickstart the census recovery that we're all looking forward to. It's really, really important that we give some thought to this. I know you've all been through a great deal, and I wanted to be able to bring you some ideas and recommendations that I've heard of in our travels across the country in doing what we've been doing. We're doing a lot through Zoom, of course, over the last few months, last year and a half, I guess. But we've been able to talk to a lot of different companies, healthcare companies, to sort of see what are they looking forward to? What do we need to think about a little bit? So I'll start off talking about kind of a historical story that you're all very familiar with, and that's the story of Wilbur and Orville Wright. We all know the story. We all know that they were the first gentlemen to get us in the air and be able to fly. We know it happened in 1903 in Kitty Hawk, North Carolina. But there's a couple things about the story that sometimes we don't know. And that is that at the time when these two brothers were working in their garage or their sort of little shed they had, putting together interesting little pieces of this and that, and nothing was really formulated, so they had to pull from different pieces that they had and piece this kind of ragtag thing together. While they were doing that, there were 2 other teams of highly educated men that were working on the same thing. One was sponsored by the government and one was sponsored by corporations. And these men, highly educated and highly paid, were given the same goal that Wilbur and Orville had. However, these 2 brothers were able to do it when the other groups were not. So you always have to say to yourself, why is that? What is it that they had that enabled them to create what you're looking at right now? Our ability now to travel the world. I'm always amazed when I'm up in the air that I'm actually there and that we're able to do this. Thanks to these 2 kind of brothers that had a passion. Their passion was they wanted to fly. They weren't going to become famous. They didn't want a lot of money. They just really had a passion for accomplishing this goal. And the other interesting fact is that as soon as they did that, as soon as they were able to, remember the times were a little different then, so news didn't get out as quickly as it does today. But as soon as they accomplished that, both other teams dissolved. They stopped even trying. Why? Because first of all, they were doing it for names, to be famous. They were doing it for money. They weren't going to be paid anymore. So I think one of the things I wanted to start out today was to really think about the passion that our sales teams need to have when they are being faced with what's coming up in 2022, let's say. So one of the things that we talked about a lot recently is trying to find the right people, the right person to be in your sales role. And JobVite just did a survey. They surveyed 1,400 recruiters, healthcare recruiters and professionals. 56% of them said that the reason people don't succeed in the job they put them in is a lack of communication and personal skills. So it's really important for us to think about what it is we want this person to do. We're going to talk about this as we get into one of the training segments. But our average turnover for sales in all industries is between 25 and 30%. So that means you're hiring and retraining your sales teams, every 4 years. So we want to try to avoid that by really looking at sitting back and thinking a little bit about the type of person that we're going to hire for these sales positions. I want to talk a little bit about what you've been able to do, because I thank Wendy for allowing me to do this and thank her for starting off by thanking you. I just spoke with someone yesterday who is an executive director for an independent and assisted living. And she reminded me that we're still buried. That's how she put it. We're still buried in this COVID stuff. And we're trying to get out of it. But there's a lot of work ahead of us. But I want you to think about what you've done, that you've actually made it through this, that you and your teams, and there's all kinds of stories about your employees, and you and all the people that work in our industry, what they've given up and what they've been able to accomplish over the last year and a half. So I wanted to make sure I mentioned that a little bit. And then I wanted to look at what we've actually gone through here. Now, these numbers are just Pennsylvania, and a little bit of help came from Pennsylvania Healthcare to get me these numbers, so thank you very much for that. But if you look at the skilled part of our industry from 2018, 19, and 20, and then I looked at the personal care side for the same years, and you can see that we have a loss of, from 2018 to 2019, our occupancy dropped from 86.3 to 85.1. But from 2019 to 2020, it dropped from 85.1 to 76.2. And that gave us a 10.1% drop in occupancy, average daily occupancy from 2018. And then if you look at personal care, where we were at 68% occupancy in 2018, we dropped to 64%, which is a 4% decline. And we all know that 1% decline in our census is a tremendous hit to our revenue. And that hit into the revenue eliminates our ability to provide the highest quality of service and care that we need to our residents. So it's truly important for us to get our revenue going back in the right direction. So now what do we do? All right, so we've been through this. Now we have to really look at what is it we're going to do in the next year, year and a half. So first, I think we need to take a breath. I really need to think we need to sit back a little bit and maybe get off the wheel that we're on and congratulate each other on what we've been able to do. And take a few minutes, hopefully at your meetings and the times that you're with your employees, that you are congratulating them on what they've been through, because it's been a terrific year and a half or so. And then lastly, we need to get down to work. We really need to get to work now. This is going to be a long haul. It's going to take a lot of focus and a lot of work for us to achieve what we want to achieve. I think we're going to see maybe not no more work from the home office or from your office, but a lot less. because it's really time to start getting our salespeople out of the office, out of the building. And one of the things to caution you on is, since everyone has been really focused on working from that office or working from their home, we've gotten kind of used to it. So we really need to kind of get our salespeople motivated again, really looking at them going on in-person sales calls as soon as we can. I know we can't do it right now, but we need to start thinking about this for our people, getting them ready to say, okay, how do we do in-person sales calls? What do I need to focus on? Right now, they could focus on just putting together a new updated customer list. What does that mean? So we want to look at a customer list that is prioritized, which means we have whoever our customers are. Hopefully you have at least 100 of them on your list. You're going to go through that list and eliminate those that aren't viable anymore, or those that we want to move back to prospects because we don't know what kind of business we can get from them. But we want to take the rest of the list and prioritize it. We want those A customers to be the people we're currently getting business from, the B customers to the people that we are getting some business from, but we know there's a lot more there to get. And then our C customers who we aren't getting business from, but we know they have it. And we need to figure out how to get there, talk to them, and get that business. So that's the starting point for getting ready for these in-person sales calls. Sometimes people focus a little bit too much on just one location. Like if you're personal care, assisted living, you may be focused only on skilled nursing to give you those clients. Maybe we need to expand that. We have physicians, we have attorneys, we have lots of people that work in our buildings with people, and maybe we need to touch base with them and see if we add them to our list as we get ready to go out and do those outside sales calls. There's also should be a focus on in-person tours again. And I know we've been doing some tours. We've been bringing some people in while we're masked and needing to do that. But the in-person tour needs to be revitalized. We need to look at this in-person tour as showtime. All the work that the salespeople do to get the person to come in the building, that tour is showtime. Your building should be spotless. It should look perfect. It should be organized. The tour should have preparations to it, like what happens when they come in, where are they seated, what do I offer them, who's going to give the tour. All of those types of pieces need to be in place before the person hits your building. So make sure tours are a key part of your plan for the upcoming year. Just get it spiffed up and refreshed. Then there's center marketing events. We'll soon be able to do them again. We'll soon be able to have people come into our buildings and have events being held there. And the buildings need to be ready for it. We need to make sure every center marketing event includes a tour. We want to make sure center marketing events are not for the current residents, they're for business development. We do have events, of course, for our residents, but when you're looking at marketing events, you want that to be bringing people into your events that could possibly be referral sources. We'll soon be able to get back to community involvement, which means you going out, and maybe you as the executive director, as the administrator, as the managers, your time now to get back out into those communities and be involved in the Kiwanis and in the community clubs and anything that you can be involved in the community to make sure that you're positioning your building, excuse me, as the place that everybody wants to go to. And then there's professional marketing events. Once again, we'll soon be able to do this. We'll be able to have events for our discharge planners, our case managers, our physicians, our attorneys, our clergy, all of them. So just giving some thought now to what's coming up. We're going to talk a little bit about planning all this, but this is kind of where we want to go in the next year. This is my mantra, always has been with our sales teams in every position that I've held where we've had salespeople working with us. You cannot sell from behind your desk. You need to get out from behind that. And we're going to soon be able to do that. So your role, I'm assuming I'm speaking with executive directors and administrators and managing supervisors, that your role is to encourage this. Please do not encourage your people to stay in the building. They have, your salespeople I'm talking about now, they have to be able to get out from behind that desk. And your encouragement, we're going to talk a little bit about that a little later too, is extremely important to this. Okay, so one of the things we're going to talk about are about 4 things today. I think 4 or 5 things we have on here about what we want to do, what we want to accomplish when we're getting started with this. So the very first thing is to assess and identify. Very often we have a goal to get out and get moving and get things done, but we forget to do the first step, which is to just simply sit back, figure this out, and assess and identify where our challenges and our opportunities are. So this is a Bitcoin. For those of you who know what this is, you're wishing that you would have gotten in on it a little earlier. The Bitcoin was created in 2008 by Satoshi Nakamoto, apparently an alias for a group of people, or maybe one person. Nobody really knows who created this. He's definitely anonymous. And the goal was, when they had to look and assess the way money was being transported, transferred, things were being purchased, and assess it and identify the challenges. So the challenges that Bitcoin identified were, number one, security. We didn't have a lot of security. Our databases were being attacked. People were being able to see and access our personal information. There were banks and governments and credit cards. All of that was involved in how all this information was being disseminated, and it was putting everyone at risk. We also weren't global. So if you had to have a credit card here. If you went to Ireland, where I went, you needed to make sure you had a different type of money transfer. So it wasn't global. It wasn't 24/7. You had to work within the confines of what country you were in or what company you were working with. So Bitcoin said, okay, we've identified the issues. How do we fix this? What do we come up with? And they came up with the Bitcoin, which is very secure because no personal information is ever shared. It's global. It's opened around the world. Doesn't matter where you are. As long as you have the internet access, you have access to Bitcoin. There were no banks, no credit cards, no governments involved in it. And it's available 24/7. So Bitcoin, which was worth 0 in 2009, they were valued at 0. In 2019, took 10 years, one Bitcoin was valued at $7,500. This is when I should have gotten in. And now today, each Bitcoin is valued at $50,099.99. So for me, the message here was they really sat back and identified and assessed what was wrong, what wasn't working. So it is now the world's first cryptocurrency, completely open payment network, and you can use it with anyone can participate if you have $50,000 apparently to buy one. My understanding is you can buy tiny little pieces of a Bitcoin, so that helps. But let's take this to us, to our industry. Before we do anything, while we have this time right now, let's really think about understanding the market demographics. What's going on out there? What's changed? Our world has changed due to this. So how is that impacting our industry? What's changed in the marketplace? Is it the same? Are they the same people? Do they have the same goals? Do they want the same things? Maybe our hospitals want something different now. Maybe our physicians are looking at a much more identified system where they look at their patients through the internet. Maybe they don't need to be in the building. Let's see what's going on out there that's changed. We need to look at our customers and their mindset. Believe me, your customers' mindsets have changed. This has changed a lot of people, how they look at things. Is the desire to stay at home increased? Is there something we can do about that? What can we work with them on? Just like Nakamoto worked with trying to figure out how to change the whole money world, what do we need to do? How can we think out of the box? How can we think differently? What is your internal process? Is it the same as it's been for 10 years? Because if it is, maybe we need to look at that process and see how it's changed. When I was an admissions director many years ago, my internal process was that we had an admission meeting once a week on Thursdays, and anything that came in from Monday to Thursday didn't get answered or addressed until that admission meeting on Thursday, where all the department heads were involved, and we all decided whether we were going to admit a patient. And then my job as the admissions director was to let the hospital know who we were taking. Can you imagine that working today? So what is your internal process today? What is your move-in process? Can you tweak it? Can you look, assess, and decide what must be different for you to set yourself apart from everybody else? What's your external process? What happens if you have a liaison or an external business person? What is that process like? Is it old school? Is it the same as it was 10 years ago? Do we need to change it? This is the time to really look at these processes. When your external person sets up a tour, what happens? What's the process in your building? Is it just whatever happens, happens? Or is there a clear process for how that person alerts the building kicks into gear, there's beverages waiting for that person, there's a conference room ready for that person, there's a tour set up, everybody on the floor knows about the tour, the executive director or the administrator has a time set aside to meet with that person. Maybe it's a new doctor, maybe I don't know who they're bringing in, but what is your process? Put it in place, think about it. Maybe it's different than it used to be. Maybe we need to do it differently. Maybe it's done on Zoom. I don't know. But we need to look at how to, number one, be different than we were, and number two, be different than all your competitors. And then there's sales readiness. Is your sales team ready for this? It's been a year and a half. How are their sales skills? Do they need retraining? Do they need some just refresher courses? Do they need to just get out and do it? And all positions that have anything to do with a tour of your building should be trained on how to do a tour. Are they ready? They haven't been doing this in a while. So this is the assess. Right now is our assess time. So if we can look at everything and think a little bit differently than we did 2 years ago, we might be able to move this forward. So once we've done that, we want to look at developing a plan. Now, we're very good at plans in our industry, but we also need to execute them. So I want to talk a little bit about the importance of a long-term plan as opposed to let's put a plan in place for next month, which we tend to really like to do. For those of you who don't know what this is the Brooklyn Bridge. The Brooklyn Bridge was opened to the public on May the 24th in 1883. It spans the East River from Manhattan to Brooklyn. First time ever. Before that, it was a ferry that people had to take. It's the first suspension bridge in the world. It has 6 lanes of traffic, a railroad bridge area, and a walkway, a pathway. So the first plan for this came in 1800. It didn't start construction until 1870, and it was finished in 1883. So think about the planning that came into place here from 1800 to 1870 before they were actually ready to begin. The plans were so detailed. They included the colors of the bridge. It was supposed to be tan and silver. They looked at the clearance for shipping vessels because they looked ahead and knew the shipping would probably change in the next 100 years. So they had to make sure they allowed for those changes that were coming. The stone towers that you see there, they needed to look at that because there were suspension cables that went diagonally and horizontally, first time ever that they needed to do that. They needed to look at the extreme temperatures of New York, and would this material, this steel, would it be able to uphold with the weathers? They had to look at the fact that the water could fluctuate up to 9 feet. So they had to prepare all of this in their planning. And they definitely put a lot of planning in place. And the bridge, a much more frequent, more look at this bridge is today. This is not today, it's a couple years ago probably. The gentleman who was the architect, the construction head of this, is John Roebling. And he knew that he had to look forward, that there were going to be a lot of changes happening. So he built the bridge 6 to 8 times stronger than it needed to be because he wanted to look forward. And that's what we need to do with our plans. So making sure that like this bridge that had all this planning to do, we need to look at the type of plans we're putting in place. So short-term plans are your hiring or what we're going to do next week or next month. We want to make sure that whoever it is we're hiring is the right person for this role. Sales roles are very different than some of the other roles in your building. So you need to really think about what you expect from this person and how are you going to identify that when you hire them. We want to put into place long-term plans. So a long-term plan for me is 3 to 5 years. Now, for some people, it's longer than that. Many of the CEOs that I've talked to on sales calls that I go on, it always amazes me that when I ask them what their long-term plan is, they always have one. And it's always 5 years out. So their long-term plans are there before their short-term plans come into place. So for instance, one CEO said when I asked him, well, what is your long-term plan? It's a 5-year plan. And in 5 years, I want the people of this state to drive past 2 other hospitals to come to us. That was his long-term plan. Now, I did talk to him then about, well, what are the other plans that are in place? And they were very detailed, which brings me to all the other plans you need to put in place to reach your long-term goals. So if you're looking at planning, make sure that you think ahead. Make sure that you're thinking not for 2022, but for 2025 or 2026. And think about what that means and what other plans do I need to put in place. So one of the things that you want to look at are key accounts. All of you have key accounts. They may be a hospital. It might be a skilled nursing company. And every key account that you have should have a plan. So there should be a plan on how you're going to work with that particular hospital or that particular skilled nursing company that's going to bring me business. It's going to get me revenue, because that's what these plans are about. So then you have a marketing plan and you have a sales plan. They are very different. We in this industry tend to mix marketing and sales together a lot, but they're vastly different. Marketing plans are plans that are geared to reach the masses. You want to be able to reach many, many people with your marketing plans. So that may be mass mailing. It might be internet. It might be social media. Those are marketing. Sales plans are one-on-one interactions. So they're 2 different plans. So you want to make sure you can combine them into one great plan, one business plan, but try to keep key accounts, marketing plans, and sales plans differentiated and pull them together under your business plan. So that's how you're going to look at planning. The next thing that we really want to look at, this is The Wolf of Wall Street. For those of you who may have missed this movie, you'll see here, and if you watch the movie, you'll see that this is the role of this person, this leader, was to coach and train his people. Now, we don't want to coach and train our people maybe like he did, but we want to be coaching and training them all the time. So training is not a one-time event. It doesn't just happen once. It's ongoing. I mean, the greats, Michael Jordan, all the greats of the world train every day, even though they're the best in the world. So we tend to want to train our salesperson and then say, well, they've been through training. So training is ongoing, and we're going to look at a couple pieces of this. But I want to talk about coaching here for you, because for me, your role as the senior executive leader, manager, whatever your role is to coach. Coaching happens every day. It's not something that you actually plan even. My mentor was Bill Brooks. Bill Brooks was the owner of the Brooks Group, an international sales training company. And when I would spend time with him in his offices, I was always amazed that he was constantly coaching people. I don't even know if I knew that's what he was doing when I first observed it. He would walk down the hall, and whoever he ran into, he would stop them and ask them a question. If it was a salesperson, he'd say, what's the 3 steps of impact? Or someone else, he would say, I know you had a sales call with Happy Land last week. Tell me where you are in the sales cycle. That's all he wanted to know. He'd stop his secretaries and receptionists and ask them questions about what's happening right now with the videos that are going on. He was constantly coaching them. And I took that lesson to heart. He said to me, if there was one thing I could bottle, and I would make $1 million, and that is to get people to coach their people. They train them, they put policies and procedures in place, and then they think they're done. And so just like the wolf on Wall Street, we want to make sure that we're looking at training and coaching differently maybe than we did in the past. So Jordan Belfort is the real Wolf on Wall Street. And his quote, to join the top 1%, you have to do what the 99% won't do. So some of this, what I'm talking about today, is stuff that most companies, when I go into them, they're not doing these things. So it's really important. They may do sales training, but they'll do it once. And to me, sales training is something that you do at least annually or maybe quarterly. Sales coaching happens daily. So when you're looking at sales coaching, if you are lucky enough to have let's say a regional sales manager, a regional marketing manager, because we don't want to call everything, in our industry, we don't like the word sales. So we kind of use marketing as the salesperson. So we'll have a regional marketing manager. But their real job is to get the salespeople up and running, get them out there, get them driving revenue, generating business to you. And so coaching that salesperson falls under the responsibilities of your regional sales manager or your regional marketing manager. If they're in your building, they need to be out of your building with your salespeople out doing sales calls. So when I was a sales manager, for instance, also many years ago, my salespeople always knew when I was coming. I thought it was important for them to know so they could plan their times and days. And I would say to them, I'm coming to the building next Tuesday or Tuesday 2 weeks from now. Please have 3 scheduled appointments ready for the afternoon. The rest of the time I'll spend in the building with my administrator, my executive director, maybe the director of nursing, but 3 calls, I'm out with you in the field. When I would get to the building, that's what we would do. I could work with them on things when I'm driving in the car, but I got to get them out of the building. So sales coaching to solidify the training that you spent a lot of money doing, probably. Sales training is not inexpensive, and usually do it for all of your salespeople. So once that's done, don't just drop it. Then we have sales coaching happening, whether it's you as the administrator or the executive director. Stop them in the hall. Ask them what they're doing. What are we working on today? I know you went to see Dr. Jones last week. Where are you in the sales cycle? Ask them sales focused questions, because then they know that you understand, you get it, you support them. And that's really important for them. Then there's product differentiation. So once you've done the sales training and you're doing your sales coaching, many times you have specific products like a rehab section, or you have let's say you have an independent assisted living. You have houses, small houses, you have apartments that are independent living, and you have apartments that are assisted living. And for you just can't seem to get the 1-bedroom apartments filled. Everything else we're doing great at. The 1-bedroom apartments we can't fill. That's a product sales training. We need to have salespeople to understand how to sell a 1-bedroom apartment. They need to know where they need to go, who they need to be talking to, and they need to have in front of them the words they're going to use to sell that specific product. I know we like to think that our salespeople already know all this, but they really don't all the time. And even if they do, refreshing them is a good idea. That's ongoing education. Keep it going for them. Make sure it's valid and important, and make sure that you are rewarding their values. So everyone has something that drives them, and it's their values. So what gets them up in the morning? What's really important to your salespeople? If you can reward that based on their values and not yours, it's going to carry them a long way. So for instance, excuse me, I was never rewarded by my salary. I was also not rewarded by my bonuses. I was rewarded by accomplishment. So for me, it meant I did something no one else could do. If I could accomplish that, if I could crack that doctor's office open and get them to refer, when I was looking at management, if I could get my salespeople to each one hit their goals, that was a value for me. That rewarded me. Not the same for everyone. Some people are rewarded by being a pat on the back, a thank you, a great job, Joe. That's a reward for them. Some people are rewarded by bonuses. Some people are rewarded by title. It's your job, I believe, as the leader, to identify what those values are and reward your salespeople based on that. It will carry them a very long way. So the next thing that we need to look at, once we've got the planning in place, now we've assessed and we've identified and we've done the right hiring and the planning tools are in place. Now we need to set crystal clear, unmistakable goals. And if you know anything about football, you know that these men that are out there they have goals. They know what their position is. They know what they're expected to do. They know they all have goals for how many touchdowns they're going to make, and how many of everything. They have playbooks for this. So one of the things we need to do is make sure we're setting crystal clear, unmistakable goals. So I want to talk about a gentleman by the name of Vince Lombardi. Looking here, arguably the greatest football coach of all times. Vince Lombardi had a stellar kind of career before he took on the Green Bay Packers. I mean, he studied in the priesthood when he was 15. He went to Fordham and played football, graduated magna cum laude, which is important to know. And then he became a coach, and he coached for West Point. He coached for the New York Giants. And then he was asked to go to the Green Bay Packers. When he got there, this was really a ragtag, unsuccessful team. He walked into their locker room and they were all sitting around. They weren't watching plays. They weren't watching videos. They were sitting around on overstuffed chairs that were worn and torn, and they really did look like a ragtag team. He walked in the door and he said, "This is the end of this." He took all the furniture with their help and threw all the furniture out into the parking lot. and ordered them all new furnishings for their locker room and their lounge. And he said to them, this is about pride. You need to be proud to be the Green Bay Packers, or you're never going to succeed. So you're prideful. This is your home now. You take care of it. These are all new for you. And then he went and he found their playbook. And he said, okay, we need to begin to study plays. Their playbook was a mess. It was hundreds and hundreds of pages. There was no organization to it. So again, out it went. And he put together a playbook of a few, I won't say a few, much fewer plays that was organized and put together for the team. He had one mantra, and it was simplicity and execution. So he was a grueling coach and demanded that they were dedicated, that they were on the field, and they gave it 110% effort. And I mean, you all know the outcome of this. Then probably he had 5 NFL championships with them and also 2 Super Bowls. So it worked, putting this all together and making sure that your team had pride and that they had crystal clear goals. So let's take that to our world. Simplicity and execution. Clarity is extremely important. Many times I talk to salespeople and they aren't really clear on what it is they're expected to do. It's almost as if someone said to them, I want you to go get me business. And that's all they said. But there needs to be clarity around what you expect. And there needs to be specificity. What exactly do you want your salespeople to accomplish? Give them the goal. And the goals need to be very specific. Today we have 5 empty 1-bedroom apartments. I would like you to work on filling those apartments, and I'd like to be down to 2 by the end of the quarter. And here's who I want you to go see and talk to. And then involve them. What do you think? Where should you be going? Do you think that us being able to fill those apartments is a realistic goal? If it's a Medicare goal, if you're at 10 Medicare and you want to be at 15 by the end of the quarter, then make that a clear goal for your salespeople. I want you in every hospital every day. I want you to visit 10 physicians every week. I want you, whatever your goals are, think about them clearly. Have some clarity around it. Don't just send them out into the woods and say, go find me something. And then involve them. The involvement of your salespeople in setting these goals is extremely important. So I know they don't have a lot of involvement in budgets, but once the budget's in place, sit down with them and say, okay, here's what we have to achieve. It's my budget too. It's what I've been given. So we have to achieve this. How can we do this? What do you think? Do you think we can get here by this date? And make sure that these are very, very specific goals that they understand. Have them repeat them back to you so they understand them. This is one of the greatest challenges I find when I go out with salespeople. They really have no clarity and nothing specific. They're out there and they know they have to generate business. Sometimes they know that. Sometimes they think their job is to fix things in the building. And I have to kind of reorient them to what sales is. And then they haven't been involved. So someone said to them, you're going to spend half a day in that hospital. Well, you got to tell them why or have them involved in that decision, because they will be that much more, I'm going to go back to the first slide, that much more passion if you help them to be involved in the decision making of their sales activity. And then we're going to look at SMART goals. Please make sure that your salespeople have what we call SMART goals: specific, measurable, achievable, relevant, and time-bound. So those are the SMART goals you want to make sure you have for your salespeople. And then the most important part on this slide is check-in. Check in with your people every day. It doesn't have to be an important meeting. I'm not saying that. But when you run into them, don't just say, hi, how are you? Say, hi, how was your sales call with Dr. Jones? Tell me about it. Where are you in the sales cycle? I know you wanted to go and see if you could set up a tour. Were you able to do that? What's your next step? Do you have an appointment for the next call? Because a sales call is not a sales call if there isn't a definition of a sales call. Face-to-face interaction, except for Zoom. We have to do it on Zoom now. Face-to-face interaction with a potential referral source that begins with a clear objective, there's your specificity and clarity, and ends in a next step. So if you keep those in mind when you're talking to your salespeople, you can interact with them on any of those. So was this your first appointment? What was your goal? What was your goal on that sales call? What's your goal for your next sales call? Do you have an appointment? Get them to tell you. First of all, they'll fall over if you ask them these questions, because then they know that you're hearing them and that you care about them. So that's the check-in. Do it daily if you can. 2 seconds, maybe not 2 seconds, 2 minutes. And then it's always important to have like meetings like once a week with your salesperson. Go to their office, sit down for 5 minutes and talk to them about what's going on in their world. And then it's get back to work. And of course, this is Gordon Ramsay, we all know, and we're not going to get back to work with quite that much passion maybe, but it is time for us to kind of put aside, kind of slough off all the dust and everything and really get back to work with our sales team. They may be a little hesitant. They're going to be a little nervous. They haven't been out there in a while. And they might have gotten comfortable being in their home office. They might have gotten comfortable coming in and working beside you and fixing all the problems, but now you need them to go generate revenue. That is why you hired them. That is what they should be passionate about. So you're going to have that passion to say, let's go, let's get back to work. But you're also going to have the team approach. You're going to sit down with them and gain agreement with them on, here's what we can do. What do you think? And every salesperson I know is going to come away from that meeting saying, I can do this. They love to be given a challenge. They love the carrot at the end of the stick. Give that to them and they will work themselves silly for you, because that's what salespeople are about. So remember, the tough get going. When tough happens, the tough get going. You are tough. You've proved this. So assess first, use a SWOT analysis, which is strengths, weaknesses, opportunities, and threats. Just sit down with your team and say, okay, what are we great at? What are we really, really good at? And be honest, what are we weak at? What's not a strength of ours? What's our opportunity out there in the marketplace? Can we think of something new and different than everybody else has thought of? And what's the threat that's coming around the corner? What's the worry that they had about the Brooklyn Bridge that you have? What's going to happen 2 years from now, 3 years from now? Put smart plans together. Make sure they are specific, measurable, achievable, relevant, and time-bound. Train your people. Make it ongoing and include everybody that gives a tour in your building. One of the things I hear all the time is that people think everybody can, they all love my building, they can all tour. No, they need to know how to sell a one-bedroom apartment. They need to know the words to use. So keep training, keep going on with them, and make sure it's ongoing. Goals, simplicity, and execution. If we can do that, we're gonna succeed in 2022. Don't procrastinate. I know it's easy to do right now, but let's get going. Don't miss the check-ins. They matter for your people. They really matter a great deal for them. I put together this kind of list, and I'm sure you will have access to this PowerPoint, but I didn't have enough time to go over all the tools that are available to you. But there's a whole bunch of tools that are available to assess and identify your SWOT, and they're listed here. And sometimes you can create your own. Sales and marketing tools. There's a whole rafter of tools that are available to you. They're sales and marketing tools. This is what they're called, but you can create your own. They are not difficult to do. You can contact me. I'll help you do that. So make sure that your engine is not made of Legos. This car you're seeing here is all made of Legos. Create a revenue engine that's tough and made for census recovery. So I thank you all very, very much. It's been enjoyable to do this for you. These are some contact pieces of information for some of my team and for me. Just give us a call, send us an email, check us out on our website. Thank you very much.
Thank you, Ronnie, for sharing this information with us today. That was a lot of information, but it was really good, and I think everybody should have some homework here. I think that's the goal here, is to re-energize and think outside the box here. So we are open for questions. If anyone does have questions, please type them in your question box on the right hand of your screen, and we'll have Ronnie answer those here in the last couple minutes that we have with you. We don't have any right now, but again, if you have any questions, please type them in. I will be sending the PowerPoint later today, along with just some follow-up information, Ronnie's contact information, the link to the recording, so that if you know anyone who can benefit from it, you can certainly pass it on to them. So look for that later today. And I just want to remind everyone that we do have our summit coming up. It's more of a leadership summit this year than a assisted living and personal care summit. So check out that on our website and get signed up for it. It's great. We have some really top-notch speakers for that. And then we have in May, we've got 2 webinars being offered by Burns and White attorneys. Those are again, both COVID related, in that the first one is going to be on potential liability that could come out of, COVID and, what we've been experiencing for the past year plus now. And then the other one is going to be around HR policies and, how COVID may have changed some of our approaches and policies, in regard to human resources. So be sure to look for that information and get signed up for it. Ronnie, did you have something you want to share?
I was just going to say that my team tells me that I tell people everything, so that's why they never have any questions.
It was excellent. It was very thorough. So yeah, it's very thorough, and their heads could be spinning right now. But yeah, I think there's homework in there, and there's a lot of things, to think about as we're coming out of a challenging, or, still experiencing a challenging year. We have a comment that says excellent webinar, so we appreciate that. If there are any topics that you all are looking for, just share that in the survey, and we're certainly happy to look into those and offer them. We are right now scheduling into July, so we're looking to schedule into the summer months and then into the fall and early winter. So we're taking it as it comes, and we've got a lot of great things planned, but we're looking to fill the schedule for July forward. All right, I think that's it. I don't see any questions. Again, I'll provide Ronnie's contact information. So if you think of anything, I always think of something when I'm driving home in the car. It hits me as I'm processing my day. I think of a question later on. So if you do have any questions, Ronnie's contact information will be made available to you. So again, today's recording will be made available on our website. Be sure to check out our other scheduled webinars. And I just want to thank Ronnie again for sharing this information with us today. It's really, we know that this is going to be a challenge for the next couple months and years. So it's really timely, and we'll bring Ronnie back and get us the most up-to-date information in the months and years to come. So Ronnie always does a great job for us. Thank you. Just want to wish everybody a great remainder to your day, and hope everyone is staying well.
Thank you.